restless legs from venous disease. The hidden connection most people never hear about. Most people assume their nighttime leg restlessness comes from things like an evening coffee, too much caffeine, stress, low magnesium, or just nerve acting up. But a major, and believe it or not, an often overlooked cause is chronic venous insufficiency. When the veins in your legs fail to return blood upward efficiently, blood begins to pool, pressurize, and congest inside the lower leg. This creates a buildup of venous pressure that directly irritate the surrounding nerve, vein and nerve. What actually happens, healthy vein push blood upward toward the heart. In venous disease, the valve become weak or incompetent. Instead of moving upward, blood falls back down with gravity and accumulate, by definition reflux. This stagnation turns the lower leg into a high pressure system, and the nerves sitting in the environment respond by firing abnormally. That nerve irritation produced the sensation patients describes as crawling, tingling, twitching, electrical sensations, the urge to move, and that's not fun in the middle of the night, uncomfortable internal restlessness. They aren't random. They are neurologic responses to a mechanical and vascular problem. Why symptoms get worse at night? And that's typical. Because during the day, your calf muscle acts as a pump. Very important. Every step pushes the blood upward and reduces the venous pressure. At night, two things happen. Muscles stop pumping, blood don't move. Number two, the gravity is no longer helping. Blood distributes differently and can pool. For someone with venous disease, this creates a sudden rise in deep and superficial venous pressure. Nerves become more reactive and symptoms intensify, especially when laying still. This is when many patients say, the moment I lie down, my leg won't stop moving. Common patient description that we hear all the time and their medical meaning. Patients often report electricity down my calf. Why is that? It's because nerve irritation. Sometimes they say we have a bubbling or fizzing, and that's because of pressure fluctuation in congestive veins. Crawling sensation, sensory nerve hyperactivity. Sometimes they would say, I have to move to make it stop, and that's not fun in the middle of the night. Movement temporarily reduces venous pressure. Although this description sounds unusual, they are classic signs of venous congestion, irritating the peripheral nerve, not a traditional restless leg syndrome. Let's talk about the misdiagnosis problem. Here's the real issue. Many people are diagnosed with restless leg syndrome when the root cause is actually vascular, not neurologic. The result, unnecessary medications, no improvement, years of frustration, worsening venous disease when the underlying venous reflux is treated like by compression, ablation, lifestyle modification, and most importantly by surgery. The restlessness often improves dramatically or actually it may disappear. If your legs are restless at night, don't ignore it. Restless legs aren't just stress, they can be an early sign of venous reflux. And if you experience nighttime leg discomfort, heaviness, cramping, or urge to move your legs, it's worth getting your vein evaluated. How? With a simple, painless venous ultrasound, that's the gold standard, can determine whether poor circulation is driving your symptoms. Stop guessing, find the cause, because in medicine and surgery the best treatment is the treatment of the cause. Schedule your vascular check with us for free or with other practice. Get answer based on real physiology, not assumption. This is Dr. BenMaamer. Let me know what you think in the comments below. Above all, stay healthy.